welcome. My name is Julian. I'm the program coordinator of these conversations, and it's a real privilege to be here. And I'm going to introduce our great speakers. The title of our talk is simply Mental Health and Well-Being. And there have been ample studies that indicate that mental health and well-being are two ingredients for manifesting peace and balancing one's life. Yet these ingredients are complex, multi-layered, and different for everybody. So today's conversation will be led by two health practitioners, Cardum, Harmon, Penn, and Tamara, Randall. Both of them have on-the-ground experience and will be sharing their insights on this broad topic. Cardum Harmon Penn holds an MA. She is a global healing and resilience educator living in Oakland, California, and is the co-founder of Our Evolution / Dialogues in the Diaspora, and the former CEO of Heart and Soul Incorporated, a social service organization. Cardum promotes a non-pathologizing and holistic approach to well-being that emphasizes resiliency, recovery, and a healthy lifestyle. And Tamara is a registered nurse and the Peaceful World Foundation's board chair and dignitary. She currently lives here in Albuquerque, New Mexico, where I'm also based. And here she serves as the RN outpatient team nurse at Presbyterian Healthcare Services, a job she recently started. So congratulations, Tamara. As the granddaughter of our founder, Sami Sunchild, Tamara is influenced by the work of taking an active role in community health building. So it's truly our pleasure to welcome them and center their voices and everyone else's. So thank you both for being here, and I'll pass it on to Heidi.
Thank you, Julian, for that introduction. It was lovely taking the time to talk to both Cardum and Tamara one-on-one. I had some conversations with both of them to help me understand a little bit about this broad scope of mental health, and particularly that we're seeing more and more facts of how mental illness is impacting our communities. And in one of the conversations, I had asked both of them, and I would like to start with Cardum first, if you can please speak or begin the conversation by speaking from a place of experience related to your work at the social service organization Heart and Soul. And from that, how would you define mental health?
Well, first of all, that's a great question, which I'll circle back on. Basically, Heart and Soul was started by people who had been on their own mental health recovery journey. And they had arrived at a point where they were able to manage their wellness and be role models and peer mentors to others. So the approach of Heart and Soul was a non-clinical approach. It was around meeting people, we say meeting people where they're at, and making sure that their voices are always heard because they are the experts in their own well-being. That's our belief system. And everyone's wellness looks different. So we prided ourselves on taking a holistic approach, mind, body, spirit, to supporting those on their recovery journey. What I learned about mental health being there was that there are lots of different things that keep people well. And what keeps me well may not be what keeps you well. So it's all about identifying what do I look like when I'm well? What are the things that could be triggers to my wellness? And what are some things I can do when those triggers arise? So it's all about empowering the individual to be with their process and with the support of a non-judgmental community that has really helped a lot of people recover and feel more active in their lives in an empowered way.
And for me, I always think of, mental health, reversed to a person's overall psychological and emotional well-being. There's good mental health, that's characterized by like a positive sense of self-worth, just overall, purpose and meaning to life. And I think during the pandemic, a lot of issues did come up. I think there were signs of poor mental health. I think those kind of we were all going through a hard time. So I could say my mental health personally wasn't that great. I mean, there was a lot of stress from my job, a lot of anxiety, a lot of depression, seeing, so many people suffer, so many people, dying from COVID and stuff. But honestly, the job that I did have, I worked at a community health center, and we did serve the homeless population. So just seeing a decline in that population, was very, very hard to handle. And what I think is also hard is, it's easier to fix a broken bone. It's honestly easier to fix, a broken bone. But when it comes to someone's mind, and what we've seen through the pandemic is, there's been a provider shortage. And I feel like there's always been a mental health provider shortage. So during the pandemic, I think that just kind of, we've realized that a little more. And I mean, it's just a sad situation, but I also think that there's a lot of resources that, that people can use. We also have to remember mental health is a continuum, and everyone experiences ups and downs in their mental health over time. But I don't know, just Cardum, how do you guys deal with, I don't know if you actually diagnose people, or, what resources do you give them?
Yeah, again, the approach is non-pathologizing. So one, we're not licensed mental health clinicians. So the breadth of our knowledge comes directly from our own experiences and the experiences of our community. One of the things that was really helpful during the pandemic, because like everyone else, we certainly had to pivot. We had a lot of community in-person based community programs. And so our first thought was, what are we going to do? How are we going to keep people connected? And especially because everyone is in their homes, and in the beginning, there's not the ability to come out. And so what we realized is that community is always community. It's always present. It may just change its physical form. So we decided to start procuring technology for our participants, our program participants. And that looked like laptops, cell phones, whatever would enable them to continue to be a part through Zoom. And the peer mentors who were the staff really helped those who had that inability to connect over technology. So it looked like the peer mentor going to the person's house, standing outside, having them open their phone and talking them through how to open up a Zoom. And so over time, the Zoom participation grew. We also created a peer warm line, different from a hotline, of course. So it was for more support if someone was feeling down, if someone was feeling overwhelmed or just disconnected. And so that also ended up really giving people the sense that I'm still not alone. It was 24/7. And so we were able to even build our community stronger because new people joined on. Those who may have had social anxiety, now they didn't have to enter in a building full of people. They could just turn on their Zoom or not turn on their screen. But that definitely gave us a different definition of community and how to support people through the pandemic.
I'd like to ask you, Cardum, a follow-up question. You talked a little bit about this, but I'm curious, how did your early experiences influence you as you started to lead Heart and Soul and now Our Revolution?
Yeah, so thank you for that again, because my love for mental health really did come out of my own recovery story. I started with a former agency, was called a Health and Human Resource Education Center. And I came there to be a program manager for community wellness programs. And so at that time, SAMHSA, which is a government agency that looks at mental health, education, and so forth, they had started this program called the 10 by 10 Wellness Campaign. And it was based on people who were diagnosed with severe mental health issues and other comorbidities. So maybe high blood pressure or metabolic syndrome, so that they tended to die 10 years earlier than the majority of the rest of the population. So they were very out of the box kind of with their approach. They decided that it wasn't just someone's physical or even emotional state that contributed to their wellness. It was also their environment. It was their spirituality. It was their sense of community. There were 8 dimensions of wellness. And so I was brought on as the campaign manager. And so I remember going to this conference for the first time. It was called the Alternatives Conference. And it was put on by people who were some identified as mental health advocates, consumers, ex-patient survivors. And so they decided that they needed a place for them to speak to each other, to themselves, in a language that they understood. And what that looked like was telling their recovery story. And so I found myself listening to all of their recovery stories and just boo-hooing. Like, I couldn't figure out why I kept breaking down. I actually had to leave, go to my hotel room, and just figure out what is going on with me. Like, why I've got all these business cards and supposed to be here making connections, and I just could not. And so I thought, okay, I need to just go back in. And so as I listened to more stories, I realized how similar their stories were to my own story. And so I started to think about the traumas that I had experienced in the past, and through child abuse and molestation and all of these things that I kind of tucked away in my psyche, and had learned how to just keep them in this compartmentalized space so that I could be in the world, be productive, be successful, look normal, whatever normal is. But, so all of that started coming back up when I was hearing other people with similar stories. So I realized that the work for me really wasn't in making business connections. It was more about making heart connections. And so that is when I started on my path to mental health advocacy and the peer consumer movement. And then that's what led me to Heart and Soul. And so that was the first time that I was kind of able to implement a vision to reframe how mental health is spoken about. We say from mental illness to mental resilience, from diagnosis to dialogue. And so it was about a complete reframe, which ended up trickling throughout the county. And so, and in the way that people looked at people who were diagnosed with mental health issues. So it was very much a personal journey that led me there, and that keeps me excited about talking about it. And Our Evolution, I did take an early retirement from Heart and Soul. I think I was already kind of reaching a place of completion. The agency was thriving, the people were thriving, and all was well. And so I thought, okay, my work here is done. Now it's time to just kind of follow my passions. And I kind of I burnt out. And I think after the pandemic, I just really all of what was required to bring us into a new way of service. And I thought, you know what, I think I've done enough, and I'm ready to just kind of pass the mantle. And so our evolution came out of my husband and I had taken about 30 people to Ghana during what was called the Year of Return. And I just got an awakening during that time that I wanted to work on uniting the African diaspora. And so that's how our evolution came about, because, connecting to each other and evolving as a global humanity, to see each other with cultural humility. And so that was the inception of our evolution.
Thank you for sharing so much. Really appreciate it all. I know Genesis has more questions. I just want to make an observation that here in Albuquerque, and Tamara can certainly speak to this, right? There's a great need for more social services. I sold my car a few months ago and I'm just riding my bike. And the bike trails are these long and winding trail system that run across or run along the arroyos or channels. And so these are places that are generally not really accessed by many people. And so a lot of homeless folks use, the underpasses where there's shade, and man, it's actually really heartbreaking, because I cross so many people that at any time of the day are just really, it looks like they're really broken, right? And it's just making me think about maybe with Peaceful World Funds, maybe doing in-person conversations where homeless folks can share their stories and come, over breakfast. Even, I know it's just, I'm just talking as I'm inspired, but the need for that sharing of those stories amongst each other, I think that's really powerful. I just wanted to mention that as a little observation. So thanks.
Thank
And
you.
also, go ahead, Cardum.
I was going to say, everyone's story matters. And when people hear each other's story, that can also be empowering. A lot of our staff had been formerly homeless or unhoused. And for some of them, it was often safer to be under the bridge than to be in a shelter. But all of it was unsafe. But, we learned a lot about the connection between trauma, homelessness, and mental health. And I think it is wonderful, because food is what connects us also.
For sure. So, I mean, just being in the healthcare, myself, just looking at the social determinants of, health and well-being. I mean, those are strongly influenced by social, economic, and and environmental factors. Because in all reality, like, wealth can increase your health. I mean, you have access to, better providers, better food. You don't have to worry about where you're going to sleep. So, I mean, it's just kind of, I mean, it is sad. But that's the reality. Just, it's what you're born into. You don't necessarily have a choice for that. So just providing those resources, I think, for that population, for sure.
Absolutely. And when you see someone recover from being unhoused, from being disconnected from their families, from being unemployed for decades, from not being able to pursue their education because of some mental health challenges. And when you see them break through that and have these successes, it really lets you know that people are so resilient if given a healthy environment. You know, all of those social determinants you mentioned are what we all need, right, to stay in our wellness. And so I mean, the success stories of what Heart and Soul staff were able to experience and be a part of keeps the work going, because people may have had experiences that broke their ability to see beyond their circumstances, but they're certainly not broken people. You know, they're in a transition period that also has the opportunity for transformation. So it's never too late.
Cardum, real quick there, I also want to just elaborate. When you and I had our one-on-one, one of the things that I kept saying to you in our conversation was coping skills. Coping skills. And you said something really interesting to me where you said that the use of language is a really powerful tool to talk about mental health, but you avoid using coping mechanisms or the word coping skills. So I was really interested in you elaborating on that.
Yeah, so, you know, the way that we see each other really has a lot to do with the way that we're perceived by others, has a lot to do with how we feel about ourselves. And so a lot of times in the society, there may be statements like, oh, he just can't cope. And there's a judgmentalness about that. You know, there is almost like this hierarchy of these are the people who can cope with life's challenges, and these are the people who can't cope. You know, and so for those who have been put in the can't cope category, it can feel very debilitating, daunting. And so what we try to do, and Heart and Soul is continuing to do, is just to speak language that is empowering and speaking to the person's perhaps future wellness, or something that they're currently doing that will support that future wellness. So yeah, language is the way someone is spoken to can really contribute to their stigma, not just the external stigma, but also the internalized stigma, right? We talk about internalized racism. It's very similar. Internalized stigma also prevents people from seeing themselves beyond the patient or someone who has a mental illness and will never recover. So that was what was behind the questioning even of that statement.
Thank
The-
you.
Mhm.
The word cope almost implies like an imminent danger. Like, I don't want to cope. I want to thrive. You know,
Exactly.
yeah. That's an interesting concept. I think too, we see a lot of people, I would say youths, but then also me, young adults, and then adults of all ages, looking for those coping mechanisms, or even like maybe they do like self-diagnoses sometimes, looking on social media, just because it's what we have available. And I'm curious what your takes, how you feel about that, what your thoughts are about that.
Well, I think self-advocacy is always the first step towards recovery. And so whatever people can do, whether it's educating themselves, whether it's identifying a supportive community, and that may be a community of one or two other people, but someone who says, I see you, or I've been through a similar journey. And so yeah, there are also tools. There's something called the Wellness Recovery Action Plan, or WRAP, the acronym, and that was started by Mary Ellen Copeland, and it was based on her experience of seeing her mother in an asylum in perhaps the 20s. And so as a child, she was very devastated by that, and so she worked a lot to identify, you know, what are the things that kind of push people over the edge. And so she started realizing that if people could begin developing actions and action plans that would help them even before a crisis arose. And so, there are different approaches to that. My other consulting business is called Finding Your Well. And it really brings in a lot of those techniques. So again, everyone's recovery journey looks different. And what helps them to be well is specific to whatever empowers them and puts them at ease. I'll just say or share this little bit about my meditation. I've been meditating since I was a child. My parents were into gurus and ashrams. And so, as well as the Baptist church, and went to a Catholic school. And, so I kind of got the gamut of different spiritual approaches. And so at a certain point, I found myself having difficulty meditating, and because that was always my wellness tool. And my mind was so busy and the noise was so loud. And so I created a soothing character in my mind, and she's called Carita, which Caritas also, I think it means healing our heart. And so anytime a thought of fear or worry or planning or any of those things arose, I would just kind of send Carita out to comfort them, to validate them, to acknowledge them. And as soon as she would, it would subside and I could get back to the quietude of my meditation. So, tools can look like anything, as diverse as each of us are.
Thank you. At one point, I had a wellness piñata that I would smack.
I love it. Yes. Wellness can look like getting your anger out, in a very healthy way. My son was having some emotional challenges, extreme duress as a young person. And so I bought a punching bag for him, kept it outside because sometimes he'd hit it so far it would fly across the room. But I think it's very healthy. Any way that is non-harming to ourselves or anyone else is a very healthy way. And interestingly enough, self-harm, people who self-harm, depending on to what degree, I know that a psychologist once told me, that's positive because that means that they're not trying to take it further. And they're just doing that thing to give them an outlet so that they don't do something more permanent. And I thought that was very revolutionary in thinking because, we think of, and I think of self-harm as like the first step towards. So to see it spoken differently really opened my eyes. So I'm not advocating self-harm by any means. I'm just saying that for some people, things that wouldn't work for me do work for other people.
Different perspective, yes, definitely. I know Heidi has some questions for Tamara as well.
Thank you. Yes, Tamara, again, in one of our conversations, we talk regularly about your observations with your patients. Mm-hmm. And I was thinking maybe you can share a bit about the trends that you're seeing in the population that you serve around mental health and mental illness.
Well, so I feel like within I would say the past 2 years, I've dealt with a diverse population. Like I said, I was at a community health clinic for 10 years. Our focus was, the homeless population, a lot of immigrants, a lot of people that didn't have health insurance, a lot of people that didn't speak English. And, working in that environment, just, being able to provide those resources, was the big thing. But most recently, I worked in a long-term care facility in a skilled unit where, it was a lot of elderly patients. And, just seeing, what I've seen is a lot of, elderly patients don't want to burden their families. And I feel like it was then up to the nurses the CNAs to recognize like, hey, this person, isn't doing too well, or they seem a little depressed. That way we can make the referral, to our counselors or the psychologist there at, in the building. But yeah, I mean, I've just seen just a diverse group of people. I mean, different people from different backgrounds going through different issues. And I mean, we did have a lot of, before I said wealth can increase your health, I mean, we did have a lot of, well-to-do people, but when they're put in those long-term care facilities, I mean, they're just like everyone else. And same thing, people just kind of didn't want to burden their families with their own issues and their own depression. So yeah, it was just kind of a eye opener of, just the importance of everyone checking in on everyone else, me doing my part as a nurse, like, hey, how are you doing? And, let's call your family. Because a lot of times the family doesn't just want to ignore them. They just don't know, and they might be busy with their life. But I mean, there was a time when I did make a call to a patient's daughter, and I was like, hey, your mom's really sad. And she was like, oh my gosh, I feel so bad. Tell her I'm going to come and visit her tomorrow. So, I mean, a lot of times we don't, realize, the things that we can do, or we don't even realize that we're not being attentive to someone else's needs.
This reminds me of, especially when elders are kind of separated from their families and kind of on their own and things like that. It reminds me that it's so important to kind of, the preventive side of it all, right? Like, obviously start building those healthy relations with others far earlier than when we're older. Obviously there's ups and downs, like everyone has been saying, but just the importance of having that connection, that social connection throughout life. I'll share something that I shared with our participants early on before we started the program today, but there's this NPR news piece that came out recently that basically was focusing on a study done with many people throughout many decades, and the number one ingredient towards well-being and happiness was social connection above all others. That's one result of that. If you want to listen to it, it's available on there. Very interesting, but also it's something like, I think a lot of us intuitively know, right? We kind of don't need that scientific data. But that's just something I wanted to share, but I'd love to open it up. If you'd like to ask a question or just an observation, please do.
Julian. So I was thinking about, that song Cats in the Cradle, the dad didn't have time for his family. And, towards the end, it's like, then you want those relationships. I think sometimes we're so busy in our own life that we forget to see what's really important. We're so career oriented that we're just like focused on this. And then it comes down to like the end of life. And it's like, well, your kids now have their own life and you kind of weren't in theirs. So, I mean, I don't know. I just thought of that song.
Yeah, it's easy to get caught up in those things. Absolutely.
It is. And thank you, Tamara, for saying that, because I was just thinking about how much our culture is focused on individualism, whether it's the economic approach, whether it's, get out and make yourself successful and no one else matters, maybe other than your nuclear family. And that could be one person, two people, a furry four-legged, however. And so when I think about a lot of other cultures that value community, there's a lot to be learned, because those who don't cast their elders aside still have them as a resource within the home. And that tends to be a lot of people of color. And throughout the pandemic, I think that did help often people who lived communally. It also, depending on the economic status, could have brought in some dangers as well. So if a mom was going out to work because she had to, and maybe the grandparents stayed home to care for the children who may have been learning online, and that mother may have brought something back into the home. So it's also interesting, the power of community, because if you are, even let's say you get COVID, but you know that you have people who are looking out for you. Our son got COVID. My husband and I, fortunately, have not yet, but our son actually got COVID, and we had another part of the house that was just, there was a door and there was a bedroom and a bathroom there. And so we kind of had to quarantine. Well, we did quarantine him. And so sometimes during that 2-week period, he would come and put his face against the glass door and go like that. And, just knowing that we were on the other side of that door, though, really helped him during that process, because he said it was less the physical aspects of COVID, but it was the emotional, it was the mental that really brought him down. And so, again, just looking at the power of community, and at Heart and Soul, we had a saying, community is immunity against, bad health conditions, against violence and racism, and all these concurrent pandemics. So yeah, breaking out of that. It's me, I'm the one who's responsible for my wellness. I'm the only person who can make myself whole. It's a misconception, and that's often where burnout comes too. So yeah, community builds immunity.
I love that. Community builds immunity. Yeah. There's always talks about how our social economic factors, like you're mentioning, they have an exponential effect, how it's multiplies, how we feel like a sense of loneliness, or our mental health isn't where it should be. And I think, just like you're saying, the solutions, if you have a good community, that could have a multiplicative exponential effect as well.
Yeah. And also, a lot of people don't have community, and it's not their fault or a particular choice. For many reasons, people may not have community. And so community can look like all kinds of things. It's about intentional community too.
Yeah, very good point.
I definitely have so many more questions that I could ask Tamara and Cardum, but I do just want to say again, we are now open, from questions or for questions from the public.
Can I just add one thing real quick? I know we're wrapping up, but I just wanted to just formally thank Tamara and Cardum for so much insight on mental health, and along with the Peaceful World Foundation for holding this space. I think that just having these spaces of community are so great. And just to have a moment on conversations of mental health, I think are just not there's so much stigma, and it just doesn't happen enough. As someone that has mental illness on both sides of her family, I always want to learn more on how many ways there are to grow, really. So I just want to say thank you to everyone.
Thank you, Gina.
Thank you, Gina.
Thank you, Gina. So if Cardum or Tamara, you guys want to share any last thoughts or words, and you guys can sign us off.
I just wanted to say, I definitely appreciate, all the work that Peaceful World Foundation is doing, right down to a lot of the grantees that are funded, just all the community outreach that those programs do is amazing. I'm just thankful to be a part of that.
And thank you, Heidi, for the invitation. I don't come out of retirement for a lot of things, but this was definitely worth it, just to be a part of your community right here and right now. So I'm so grateful. I've learned a lot through those who've shared, and it's just really inspiring to know that Sami's legacy continues through the wonderful work that you all are doing at Peaceful World Foundation. So thank you again.